Welcome to GW Integrative Medicine, the podcast about disease prevention and health promotion from the Office of Integrative Medicine and Health at the George Washington University School of Medicine and Health Sciences.
I'm Dr. Misha Kogan, Associate Professor of Medicine here at GW and Medical Director of the GW Center for Integrative Medicine.
And I'm Janet Rodriguez, the office's Administrative Director. Today we're talking with Marianna Shimelfarb, MD, who specializes in Integrative Family Medicine. She practices patient-centered care and uses her knowledge of evidence-based complementary medicine treatments in combination with her training as an allopathic physician.
Dr. Shimelfarb is an Assistant Professor of Family Medicine at Hackensack Meridian School of Medicine, and Marianna has been my personal friend for decades. We go back to early medical school years when we did some work together on preventing student and physician burnout. Welcome to GW Integrative Medicine, Marianna.
Thank you. I'm so happy to be here.
We're glad you came. So, out of the blue, I get an email from Misha about doing a podcast on taking care of simple medical issues at home. And so, am I right, Misha, or did I read it wrong?
Well, no, of course you're right. Except that as life has it, Marianna and I were sitting at this Russian music festival some weeks ago, and usually when we get together, we start talking about things that our families don't necessarily want to hear. And we were like, well, this and that, and we have this problem, we have that problem. And next thing we're like, wait a second, but wouldn't it be so nice to just kind of talk on the air about all this, and just so that finally our listeners can actually have a sense of, well, what do the docs talk when they're, processing things between themselves, and what are some of the things that we wouldn't dare to necessarily speak in front of our family. So that's how the whole idea came up. And then we started talking a little bit more, like, what do we actually want to cover? And I mean, of course, the topic of how do we take care of our own families, that's a big one, and I think that's one we'll kind of start with. But there are some other things that I think if we get to that, then we'll cover too. So, yeah, Marianna, you and I go back to, is it 2003? Something like that.
Something like that, 2002 or 2003.
Yeah, when we were medical students, we had no idea what the hell we're going to do. We were like, drifting through the medical school. I'm not afraid of saying this, hating half of it, if not 75%, kind of thinking, only if we can get through all this nightmare, and we don't like what we're learning, and we're all this holistically oriented, both of us, and we want to do something like that, and now we're doing it. But we're still kind of complaining. So
that is all true.
Anyway, we're practicing in different states. Our families have kids and dogs. Turns out now we have an exact same amount of kids and dogs, as I learned just a few minutes ago. And stuff comes up all the time. So let's talk about that first, shall we? Let's do this first. Think of one most recent thing that came up in a home that you're like, oh my God, I'm a doctor. I really don't want to deal with this, but I don't want to send the kids to the doctor. I'm going to have to take care of it. Go.
Oh my God, there's so many examples. I don't even know which one to bring in. Can I start with the dog?
Yeah, sure.
I think very timely. We're recording this just before Halloween. And, Halloween is a fun holiday for kids, but I'm thinking also it's a time when a lot of people can go in disguise and pretend of what they want to be and look as if they were something that they're not and create a myth. And so I'm hoping with today's recording, we'll dispel a little bit of a myth that doctors have created around themselves. We, all the years in training and then after, we pretend to be to wear this ammunition and being impenetrable. We have this belief that nothing is going to happen to us and we'll live forever. And when it comes to the family, I think we kind of apply the same principle. Oh, you're bleeding from the head. you'll be fine, and you covered in allergies. You can just go to school. And with time, I think you learn that principle is just doesn't work, and you need to pay attention to your home problems as carefully as you do with your patients. So I think that's where the challenge lies. But I think one of the recent examples was that my daughter, my younger daughter, she fell and she split her chin. And usually, and this was while we travel, and usually when this kind of things happen, I kind of take a look and I say, okay, the bleeding has stopped, and you don't need to suture the laceration. Let's go on, put a Band-Aid on. So she then went to school and she fell on that chin twice more, and she lacerated it, or she broke it at the skin at the same place. And I had the same attitude. Okay, we don't need to suture it. Moving on. So what happened a few months later is I noticed she has quite a scar in her chin. So I went back to her pediatrician. I said, Larry, have I taken her to the doctor when this happened? He's like, I see he was trying to not make me feel bad. He said, well, a lot of children have a scar on their chin, so she'll be fine. But it's just one of those situations where, somebody who is not a doctor definitely would have taken the kid to be evaluated and maybe have prevented a scar in a little girl's chin where, we just don't.
All right. Well, I have exactly the same story. Seva was 3, fell. Of course, it was Peter's birthday. So he's falling, cracking his forehead open pretty deeply. And this is while we're like expecting 12 kids here for the Peter's birthday. And I'm like, I'm not taking him to emergency room. So we literally, so Seva's running around screaming Bloody Mary, bleeding all over. So we finally caught him, tied him to the bed, and I sutured it after giving him local anesthesia. So this one, at least 5 minutes later, he's up and running again now, tracing the kids that are there for the party for Peter, as if nothing happened, by the way.
So you really had to chase the boy around the house?
Yeah, because he wouldn't. I mean, he wouldn't like. He's like he fell down, screamed for a little bit, then started running again as if nothing happened, while the blood is dripping down his face. So we had to do something. I'm guessing that a lot of the docs who have kids have something like this, that we're sort of like, we'll take care of it ourselves, and then realizing later, oops. So that actually, after that, since I have not done any suturing, I would take them over just because I was like, I'm not sure if I qualify. It happened like multiple times since, and frankly, here's the sad part. The way I sutured it, it doesn't look any worse than what happened subsequently when he had 2 more cuts that had to be sutured, and everything has about the same mark, whether I sutured it or somebody else had. But it's not a good excuse, and the reality is you're absolutely right. I mean, we kind of let situation potentially unravel a little too far. So that's one particular topic.
Well, actually,
but go.
Yeah, to add on that, actually, the most recent situation I just remembered was that we were riding bikes. This was just maybe 3 weeks ago, and on this beautiful path, and it was a beautiful day, and we all thought this is just going to be a great day. I was on call that day as well. It was a Saturday. It's going to be a great afternoon. And just 10 minutes into the bike ride, and again, my younger daughter, who is 7, she was sitting on the back of my bike, which she has done before. I just hear her, wah! And I turn around, and her foot is just embedded in the back wheel. And it's twisted. I mean, I cannot describe you. So we stopped the bike, and her foot was totally twisted. It was purple and blue, and I thought she surely severed a ligament. I mean, it was terrible. And it was, we stopped the bikes. My husband brought the car. We brought her to the car, and it was, I think, 4:30 p.m. on Saturday. And I looked up pediatric urgent care that belongs to our organization where I work, and they were closing at 5. And then I called PM Pediatric, and they said the next appointment is at 9 p.m. And I just stood there and I looked at her twisted foot and purple, and she was in moderate amount of pain, and I was like, oh, I will never go to ER unless unless they really have to. I was like, to wait till 9 o'clock. And then I told myself, wait, you're on call. Somebody called you with their kid with a twisted foot and a bike accident. You would have told them exactly what to do. So just do that. I commanded myself. We went home, and then she also exactly did that. I did that. I had to talk with myself. Oh yeah, she also really badly scraped her skin, like it was like second-degree burn. It was terrible. I told myself, you're on call, just do what you would tell others to do. So I took her home. I put, slathered some silvers in, and put arnica cream, and I put Band-Aid, and I gave her Tylenol, and I ace-wrapped it, and I iced it, and I elevated. She was happy as ever. She thought I was the best, the coolest mom on earth, really. And so that was Saturday, and she was feeling better, but then she couldn't put weight on her foot. And then Sunday came, and then on Monday, I actually I went to work, and I was talking to myself all day long until I talked myself into actually taking her to our pediatric urgent care, because I kind of am learning that I cannot take responsibility for my children's health. I need someone else to help me with that. So I took her after work. I went at 6 p.m. It sucked to pediatric urgent care, and they were amazing. I did X-ray, and they did exactly after that, when they ruled out fracture, they did exactly what I did, but then I felt better.
Good. All right. Well, you were talking about how we would go to emergency room through our dead bodies, literally.
Yeah.
Let's talk about that a little bit, because that kind of pushed me to think one of the things we wanted to talk about is, we know the system from inside out. I mean, we know what it can do. We know what it cannot do. And unfortunately, we know a lot of, I don't want to say scary things, but we know things that, so we use the word iatrogenic, which means that the system itself can cause a lot of problems to our own health. And, we in some way, as a providers, as physicians, pretty scared of that. I was recently diagnosed with acute Lyme disease, and I ended up going finally to like a cardiology, and then, taking tests and all that. But, I realized that part of my hesitance to go and deal with this was not just, any kind of shame or symptoms were not severe enough. No, I think part of it was I was just literally scared as to what can transpire, what kind of aggressive interventions or measures can be applied to me that will actually worsen my health, not improve. And, I see this a lot, especially in older adults, but even in the younger people, I think it's definitely part of our internal, I would call this like a fear factor. Like we're afraid that if we accept some kind of standard care, we will have side effects. And I think, we probably more tuned into this than some other doctors, simply because we know a lot of holistic integrative modalities that are safer. But regardless, what would you say, Marianna? How would you reflect to this?
I think that fear of losing your own agency and being a subject to somebody else making decisions, and not always the decision that you concur with, is very deep. And I do agree with you 100% that, because you and I both practice integrative medicine, our view of especially aggressive Western medicine approaches is somewhat different from mainstream, perhaps. So I think that also definitely plays big part in us making decisions about when to engage in involve in conventional medical settings for ourselves and for our families. And, I've shared with you, I have a close to me family member who's unfortunately suffering with complicated medical issues. And the most painful experiences that I've had in medicine was being the family member and trying to participate in their care as a patient's family member rather than the physician. And the pain is because you see the gaps in care, and because you wish communications were different, you wish that that connection between body and mind and goals of treatment and goals of care were kind of intertwined, and when they're not, um,
And they're often not.
and
So
they're often not.
just like they're probably in the complex cases, more often they're not than they are.
Yeah.
And that's that's a sad part of reality. Yesterday we had an interesting grand rounds on, it wasn't directly COVID related. It was basically talking about heroism and duty as a physician during pandemic. And towards the end, this interesting conversation emerged that a lot of us are burned out. And I want to kind of go back into that a little bit deeper because you're an expert on that topic. But, it's not just we're burned out and a lot of our physicians leaving profession, but I think a lot of us are simply discontented knowing that the public views the healthcare system often in a very negative content exactly because of that, because they're seeing that we're not communicating well. They're seeing that often care is fragmented and not whole. And even when we try, the system itself, there's so misaligned the incentives that it's hard to achieve that. So we know that intimately well, and it sort of, it pains us probably more than a regular than non-provider, because we know that we could do better, but we can't get there. I mean, we're trying, but we really can't get there. And even you and I, even more so, because we know the alternatives. We know that we can take a lot of the problems a lot better. Anyway, sorry, I went on a rant.
No.
here.
I mean, this is just a subject on its own. We can talk about this, and we do for days on end.
Right.
The big issue is lack of communication and again conjoined process, because neither you nor I, we don't have a magic wand. We just really try hard to truly be patient centered, right?
Mm-hmm.
And often my focus is on undoing, where the Western medicine principle is doing.
Mm-hmm.
So when we don't want to go to ER or doctor's office, or we don't want to take our kids there because we're afraid something is going to be done to them or to us,
Mm-hmm.
and you don't want to be things done to you, right? You want someone to tell you, these are your options, or these are the goals, and instead things are just done. So that's
all right. So we were gonna have fun and entertain our
Okay.
listeners. Now we're in a gloom and doom. By the way, this is actually what happens when we get together and we start talking. Because guess what? We've known each other for a long time. We're close friends. We just, that's how we sort of help each other. We kind of,
Well, it's how you're processing.
Exactly. That's how we process some of this darkness. We'll promise we'll come back to the light in a few minutes. We're not done yet. But there's one other topic that I really wanted to touch, and I know Marianne's very passionate about this one. So we are back in medical school. Actually, what we did, both of us, we tried to create pathways for our students to feel somewhat better about the fact that there's just not a lot of holism in medicine. We participate in this series of HUMED retreats, and Marianna, you did a lot subsequently to try to help our colleagues. Tell the listeners about what you did during the pandemic, because you formed this little kind of burnout prevention group.
Yeah, I was in March of 2020. I reside and I work in New Jersey, just 12 miles, in 12-mile proximity to New York City. So everything was close to home, what was happening, and so I had a big impulse to do something, and I have connected with integrative psychiatrist from Utah and a PhD psychologist from this area who specializes in death, dying, and trauma. And we created once weekly online Sunday group for all the physicians across the country who were willing, able to attend, and it was a weekly support group, and it was amazing. We ran it for a couple of months. It was very free flowing, but we had some just amazing conversations at that time. But physician burnout and wellness has been my long-standing interest. I want to round back to home, actually more on the fun side, some home remedies, right? We can talk about that some, right?
Yep. All right.
So what happens when my kids have cold? And Misha, feel free to jump in. Not when my kids, when your kids, So when we see when happens when my kids, my girls come and one of them has a sore throat or runny nose or looks febrile, I take out all of my herbs. That's the first thing that I do. I have like, I don't know, 10 little bottles or bottles and pills and syrups. Some are, my favorites are Omka, which is extract of pelargonium, elderberry, and then there's some mixes of different kind. And so we just take it out of, put it on the kitchen counter, and I mix it up and with small amount of water, and they take a shot glass. And they're so used to it. I'm afraid they're going to grow up thinking that's how the world lives. Everybody takes herbs. Or just the herbal world, which is maybe not the worst thing. So they take herbs 3 times a day, probiotics, some, fish oil, and usually within 48 hours, they're totally back to normal. I rarely give them Tylenol or ibuprofen, only if they have very high fever and they're uncomfortable, or in the instance that I mentioned earlier, if they're like bad pain caused by accident, God forbid. So that's how we deal with colds. It works each and every time. If they have one of them tends to get sometimes a little too excited and becomes a little too demanding and difficult to manage.
No, that never happens.
Yeah. Whining. I have some herbs for her. I have chewable, she calls them my gummies. Give me my gummies. Give me my gummies. She's in pajamas in the kitchen. I have to give her gummies. And that is L-theanine. She gets her 2 gummies.
So for our listeners, real quick, so L-theanine is an extract from green tea or can be made synthetic, but it's a very benign but very strong anti-anxiety that doesn't actually put people into slumber. So like in contrast, some anti-anxiety pills, they can be quite lethargy inducing. L-theanine is actually focuses, so it drops the anxiety somewhat, but it helps to focus. It's kind of a perfect for a running 7-year-old who's give me my gummy and I don't want to do anything, and yet mom needs to concentrate on tasks and she needs to concentrate on her homework. So that's kind of a perfect remedy there.
Yeah, I usually use it. Thank you, Misha. I usually use it at night, and in the morning she wakes up all calm and ready to go. All good. I have some for myself too, just FYI. But and then in the bath, I've minimized the soap use since they were babies, and I'm not as granola as I may sound, actually. But I don't use bubble baths and things like that for a number of reasons. So they're also, when I draw them bath, they're like, put my oils in. So where are my oils? They're a little. One of them is a little demanding. It sounds like, right?
I confirm.
And what oils are you using, Marianna?
I use eucalyptus, and I use some, and then variety. Use eucalyptus and lavender most commonly. I just use 5 drops of each. Mm-hmm. It's actually very nice because you just it's like puts a very nice aroma in the bathroom, and just So this is some little little home remedies. We just if the listeners would like to acquire some, they're the lines that we use for the herbal drops are called Gaia, Gaia, Gaia Space Kids. And I'm
going to assume that it's organic.
Yeah, yep. They're a reputable herbal company with great naturopaths behind it who formulate great combinations to use. And what I like about the herbs, the tinctures, the drops, is that you can titrate them up and down.
Mm-hmm. And it's a great company also because it's not just nutraceutical grade. So I mean, it's a nutraceutical grade, but it's retail, so you can find them pretty much anywhere.
Right.
They're not like behind the closed counter. I just want to add a couple of things. So one is we used to use a lot of aromatherapy. Like at bedtime we would put on some kind of a soothing smells for the like lavender, for example, but also for concentration. And we have now that they're in separate bedrooms, like they each had their own little. Well, it's not a nebulizer; it's a aromatherapy producing diffuser. Thank you. And it's a little bit less now, but we still occasionally use it. And the other one is a topical. Marianna has two boys. Marianna have two girls. I have two boys, and both of them into sports. So bruises are pretty much daily entertainment in our household. And so I found a couple of things. So, well, of course, arnica, Marianna already mentioned, topically all the time. Kind of, we have two types. We have regular arnica, and then I like this product called Traumeel, which is a little broader. And when the trauma is a little more significant than just a little bruise, sometimes I'd use that. And then we use a lot of topical CBD and even topical THC, depending on what the problem is. So if the problem is more acute, it's a bruise, sometimes I would actually use 1-to-1 THC to CBD on both of them because I would want them not to take any oral pain control. I'm just like Marianna, I'm very aggressive at trying not to give them anything for pain. Seva had a dental extraction of a baby tooth yesterday, so I had to give him Motrin. But other than that, we try to avoid any oral peels. And Marianna, you can add more, but basically what we're trying to do, we're trying to have their system control the systems to the maximum of what it can and not get used to, pill for every ill kind of logic that's so prevalent in our culture.
I'm also reflecting on the fact that both you and I grew up in Russia.
True.
That's true. That's the culture. It's a culture where we were brought up to tolerate things, right? It's like, you don't complain, you don't, just carry on, be strong, don't cry. I think that also, it's not just that we only the physicians, but I think our upbringing also impacts how we bring up our children.
Right.
Yeah.
Right. That's a good point. All right, let's talk a little bit about harder topics. So behavioral stuff. Yeah. Well, no, we're just gonna concentrate on behavioral stuff in our own families.
And our behaviors.
That's easier.
Let's bring the spouses in. They'll talk about our behavior.
Yeah. Well, thank God both of our spouses are, they're kind of used to, and they're both of them can take a little bit of sharing of stuff. But generally, I find it what's more challenging is, when my behavior is not where I want it to be, and I'm like, oh my God, if this would be a patient in front of me, I'd send them to a psychiatrist. Why am I behaving this way? And I think that part I've always been kind of wondering. I mean, I've always been a little, heal the healer. But when it comes to behavioral stuff, it's much harder than like bruises, cuts, and whatever. I mean, well, we're not psychiatrists, either of us, but still, like, reflect on that. And I know you've done a lot of reflection on this, but I just want listeners to kind of hear your voice and your take on this.
Do you want to talk about behavioral stuff as far as the kids, or as
whatever?
When we feel down, depressed, and hopeless.
Let's spare. How about this? Let's spare our listeners that, because our whole plan was to make it entertaining. I think let's not go back to sad stuff. Let's just stick with more upbeat, and let's just stick with kids, because they throwing at us stuff every day, and again, we know medical things, and we're constantly questioning: is this a normal behavior, or is my kid needs a psychiatrist tomorrow?
Right. Yeah. Yeah, it's true. My younger daughter did not speak in her preschool or daycare for a year, since she was from the age of, she started when she was 2.5 until she was 2 years. She didn't speak there for 1 or 2 years. As in, literally, she did not open her mouth there. She spoke at home, 2 languages, but not there. And then I think at the end of her second year there, when she was 4.5, right? She said, one day she came in and she said, I decided it's time that I speak to you all.
And now she can shut up, right? Is that
She can't shut up right now. No.
Can I ask a question?
Yeah.
Is she the same way that's very demanding about the oils in her bath?
That is correct. Yeah, that is correct. She's the same one. She's the same one who there is a number of things one can tell about Aviva. Yeah, but that is her. Mm-hmm. That is her. Yeah. Yeah. So she and so if we I spoke to it was a very, very mindful, play oriented, still is preschool that I love very much, called Playhouse. But I spoke to the school directors and they said, well, it could be normal behavior. And I think I mentioned this to our pediatrician. I may or may not have, because we only go once a year about that. But if in other circumstances, it probably would be called selective mutism, which probably is, and maybe early interventions would have started. But in her case, we just let it be. She, when a year later into that quietness at the daycare, she started to develop some tantrums, and it took me another few months to actually call my friend, who is a very good child psychologist, and say, listen, do you think all of this is normal? And she said, by far not. She's experiencing anxiety. And I almost died. I still remember I was walking with my dog in the forest. And, no dog, just me, no dog, phantom dog, a phantom dog. And so anyway, that took us to another journey. But of learning about young child and anxiety, and again, we did not want to divert to pharmaceuticals or labeling, and we ended up. It was a fascinating, and still is fascinating, journey. And I think we've helped her and ourselves carry through. But I've learned so much about being a parent and having a child with anxiety. And as a family physician, I see families. I love my job. In that regard, I see mommies, daddies, I see newborns and up, and I see lots of grandparents these days. And so this whole experience made me incredibly empathetic to any parent who has a child with any kind of behavioral issue or developmental issue or anything that makes a parent just get more involved than your usual parenting. And I'd say, by emphasis, when I have my parent patients in the room, my emphasis always is, you have to also take care of yourself as a parent. Because one of the biggest reflections, I think I'm going to arrive to my point now, my biggest reflection on this whole experience with Aviva was that you have to, in order to help your kid, you have to balance yourself out, especially when you're a mother. You have to, if you're in harmony and you're in balance, your home will be. And if you're not, there's no hope that it's not going to manifest in one of your children. Yeah. So.
Yeah. Yep. Yeah. We have a similar story. Our younger son has attention deficit, and it's actually interesting that we missed the diagnosis too for a long time, and we ended up thinking it was trauma, that he had an accident when we were traveling in Spain, and we kept attributing everything to that accident. And then we finally said, let's do a kind of a comprehensive neuropsych eval. And yeah, that's what the neuropsychologist said. His trauma is there. It's not the worst thing, but he has a pretty bad attention deficit. And I think this is a lesson of when we see inside our own families, we see things through a different lens, and it's impossible to be completely emotionally detached, to be able to look at the picture in a clinical eyes and say, okay, this is what this is. So, and I kind of wonder, the listeners, it's a self-explanatory thing. That's why we not to treat friends and family. It also reminds me that we were going to talk, we're running out of time, but we were going to talk about when our friends calling us and saying, I have an emergency, help me. It's kind of the same way. Like there's a reason why we should not help people close to us, because in reality, it's hard to be impartial and it's hard to be emotionally untangled so that you can actually clinically do the right decisions. It took you you were pushed to extreme to think when the foot got stuck in the wheel. You had to say, okay, wait a second, what would I do as a physician on call? But that's not so easy to do. But I don't think we should end on this.
I have a few fun stories.
Great.
If you want to.
Let's do it. We have a few minutes.
So, I have a group of friends here, and a lot of them are physicians, and so sometimes they go on trips together. And one of my favorite stories is a couple of years ago. This group we didn't go. This group went kayaking, and I don't know. Let's just say in Maine, and they were kayaking hard, and adults and kids alike all day long. Then they finally landed in a campsite. They were all very happy, and they were relaxing. And the kids went fishing, and one of the kids just landed a hook in another girl's leg. He missed.
Of course.
He missed, yes. And you know how those fish hooks are made is that you're actually destined to not be able to remove, right?
Right.
So there were at least 2 surgical or ER specialty physicians on site amongst parents. They were not able to remove the hook. So
wow.
Yeah. And so the kid had to be taken to either urgent care or an emergency room in the middle of nowhere. So that's one. Another one of my favorite stories, also not mine, but also good friends, having went to somebody's house, like let's just say birthday party, and it's 11 p.m. and their son my friend's son just runs into this beautiful glass table and breaks his forehead. So the host of the house is of surgical specialty, just takes the kid. They go around to his office in the same house, and my friend, the mom, holds her son, and he just sutures her like at midnight. Not her, sorry, the kid.
The kid.
The kid, yeah. It just.
Yep.
Yep.
Just like that.
Yeah, and the third one is my daughter, Batsheva, who says whenever we just, if she ever has to take antibiotics, I'm like, which one are you allergic to? And she says, I can't remember. She says, Mom, that one that when I say that, I'm like, which allergy are you allergic to? She said, that one that caused me to be purple and red from toes to head, and you send me to school saying, just tell them you're fine, it's just allergies. The nurse in elementary school probably thought I was the evil mother doctor, because she was literally covered with hives. Oh.
Have you been experimenting on your child at home?
Yeah.
Mad doctor.
All right. I promised our listeners that we'll end on something. Well, I promised to myself that we'll end on something positive here. So far, we're failing spectacularly. All right. So one example that comes to your mind of things that are positive. in the kids. So I'll go first so you can think. So I'll never forget this. This is about, so now they're 14 and 12. So this is at least 5 years ago, maybe even 6. We're in a Trader Joe shopping, and I'm noticing this scene. There's 2 boys standing in line, like there's this power bars. They're standing like in front of it, and one of them can't reach even like a second shelf or third, whatever. So like he's trying to reach up there, and showing Peter, show me this one. So they pull that thing off the shelf, and they're standing and looking at the label, and then the guy's going by, the salesperson, and these 2 boys are looking and saying, Sarah's like, Peter, this doesn't have enough protein and there's too much sugar in this. Peter's like, yeah, it's 1-to-1 ratio. It's probably not so bad, but let's look at this one. And so this guy that's walking, he stops, and he literally puts down the basket that he was carrying. He's like, wow, new kids. I wish I'd videoed that to show them later. But that was like, for me, it was a moment of epiphany. I'm like, well, I taught them something. Anyway, so that's my example.
No, that's great. I have one. So a few years ago, we went to take someone to the airport, and when we arrived to park, I saw a car with a woman who had a kid who was sitting on a potty in the middle of a parking lot. So we parked the car, went to take our family to the airport, and an hour later, when we were ready to leave the airport, same scene was at the parking lot. There was a woman and a kid on a potty. So I thought, whatever, it's their business. And I went into my car. But then my 7-year-old daughter, she rolled down the window and she said, "Ma'am, are you okay? Because my mom is a family doctor and she can help you."
That's great.
So
that's great. Well, we're running out of time. We can keep going like this for hours. Well, it's actually what we do when we get together anyway. We're not doing anything we're not doing when we're together anyway. But we got to wrap up. So, Marianna, give our listeners one pearl before we let you go.
My biggest pearl is listen to your gut. And if you have a situation with yourself or with your family member and you feel like they need attention, drop everything and just focus on that.
Because there is nothing more precious than a friend and a family. You're not going to have treasures that we have this expression in Russian that summarizes this perfectly. Don't have 100 rubles, have 100 friends.
I like that.
Yep. Well, that's all the time we have for today. Thank you for joining us, Marianna.
Thank you very much for having me.
This is the GW Integrative Medicine podcast from the GW Office of Integrative Medicine and Health.
I'm Dr. Misha Kogan.
And I'm Janet Rodriguez.
Thanks for listening.